Winship has had a tremendous year in 2013. Our research is continuing against cancer in so many different ways. We are extraordinarily excited about the opportunity to enroll our patients in new trials and to take the discoveries that our physicians and our scientists are making them and apply them to cancer care.
We started the year by inaugurating the first named center at Winship, the Glenn Family Breast Center, thanks to donations totaling $10 million from the Wilbur and Hilda Glenn Family Foundation.
I think that's allowed us to really make a lot of headway in terms of, developing research projects, developing infrastructure, developing clinical trials, and really trying to expand the breast program.
Over the winter, the waiting room of the infusion center got a complete makeover, and Winship's clinical trials program grew, testing new therapies for multiple myeloma, lung cancer, and many other cancer types. Since 2006, 75% of all new FDA-approved cancer drugs have come through Winship.
We will enroll over 800 patients with cancer on new therapeutic trials here. And over 40% of those trials will actually be trials that have been developed by our Winship investigators.
In May, we had the official groundbreaking for the Emory Proton Therapy Center. Throughout the spring and summer, Winship investigators made news with discoveries such as chemoprevention for head and neck cancers and new brain imaging techniques.
New ways to use targeted therapies for various important tumors, playing a major role as leaders in accruing patients on some of the most novel immunotherapy protocols, really being leaders in cancer chemoprevention, as well as studying ways that patients have side effects from treatments.
In September, the Bone Marrow and Stem Cell Transplant Unit celebrated their 4,000th transplant.
Happy, happy birthday, your cells are finally here. Happy, happy birthday, it's time for us to cheer. Woo!
And that transplant represents their hope for an ongoing life, for happiness, for getting back to their normal life.
In October, the third annual Winship Win the Fight 5K drew nearly 3,000 participants and raised close to $500,000 for cancer research. And despite federal funding cuts and a government shutdown,
we have not paused because of some of the external challenges. We've just continued to accelerate our vision on how to help in cancer discovery and its applications to patient care.
Winship welcomed several new members in 2013. And Winship leaders received several distinguished awards. In April, Dr. Fadlo Khuri was honored by the American Association for Cancer Research with the Richard and Hinda Rosenthal Memorial Award, recognizing outstanding contributions to lung and aerodigestive oncology. In September, Dr. Walter Curran was named the Georgia Research Alliance's Eminent Scholar and Chair in Cancer Research. In December, he was elected to the Board of Directors of the American Society of Clinical Oncology.
Every time we make progress, we see other opportunities to discover. Our work really has no foreseeable end in sight. I just want to thank all the tremendous faculty and staff who are part of Winship. None of the progress we've made, which applies to our patients and patients far beyond our walls, would be possible without your extraordinary dedication.